Hello, I'm Dr. Swann, and I want to personally welcome you to Swann Dermatology. I'm a native of Springfield, Missouri, and I grew up here, went to Kickapoo High School, went to college, started at Missouri State, finished at the University of Oklahoma, finished medical school there, and then did more training, an internship and residency in dermatology at the University of Missouri in Columbia. And then I finished training with a couple fellowships out in California. One in Mohs micrographic surgery, that's for skin cancer and reconstructive surgery, and then another one called procedural dermatology, which is laser and cosmetic dermatology. You know, a lot of things that we do in medicine are very linear, and there are judgments based on whether something's positive or negative. And there's an artistic side to both Mohs surgery, the reconstructive part, and then also to the reconstructive cosmetic work that we do, to even Botox and fillers and things that we do to make people look happier and nicer. And so it was that right brain, that creative side that really lured me in. It was actually it was a combination of a lot of things that made me realize that what I really wanted to do was something where I am using and integrating the best parts of who I am to be the best thing in a physician.
Hi, my name is Autumn Courtney. I am Dr. Swann's physician assistant. I was clinically trained by Dr. Swann to examine the skin for any cancerous and precancerous lesions. My educational training first started at Drury University, where I graduated with honors in pre-medicine, and I went to Missouri State University, in which I achieved my master's in physician assistant studies. I look at the skin with both my right brain and my left brain, being that I am an artist, to monitor any suspicious lesions.
Instead of taking a blind margin, a surgeon taking a blind margin to make sure that they got all of a cancer, most surgeons is a very exact way, precise way to take that cancer out. For example, if you come in and you have a tumor that looks like it's on your nose the size of, let's say, a pencil eraser, that tumor may be bigger under the microscope, okay? And what we've learned from big studies is that you may have a tumor the size of a dime. So in practice, a surgeon, a general surgeon, plastic surgeon, even a general dermatologist not performing Mohs does an excision, which takes a dime-sized piece of tissue off your nose. In Mohs surgery, what we do is we start with the pencil eraser, and we map that and look at all of the margins under the microscope in such a way that we have absolute certainty that we're looking at the true margin. If there are roots that are positive on an edge, then we go back and extract precisely in the area where they're positive. With Mohs surgery, patients are going to be with us for a few hours. We usually tell patients a worst case scenario, they're going to be here 4 hours. The nice thing is we have a facility here where we have a very relaxing back waiting room that's very comfortable and has things to keep patients very comfortable during their stay. But in the end, they do need to know that they're going to be here for a little while. The nice thing is when you are done and you leave, you've been here 3 hours, you know your tumor's gone. You're not waiting for a phone call next week. You're reconstructed. The healing's already begun. You're not waiting for somebody to call you next week and tell you, did we get it all, did we not? And so that's one of the other nice things. You do have to wait, but in the end, you get your answer. We start with great topical care. We believe that topical care, things that you put on your face, creams and lotions, should be scientifically based. You can go to department stores and spend a lot of money on a lot of products that have great emblems on them that have no scientific background at all. And I specifically use things in the office that I know have researched and believe they really will provide benefits for patients. I really believe in using growth factors for the skin. Growth factors are essentially skin plumpers. They help the skin cells naturally not only moisturize themselves, but they encourage normal daily activities, things that the cell does all the time. They do it better with growth factor. And so what happens is more moisture is brought into the cell and nutrients along with that to encourage the skin to be plump. And growth factors are one of the only cosmetic things that can be calming. There's been a great deal of research on it. I believe a great deal in growth factor, and we have products that contain growth factor for that very reason. Ultherapy is microfocused ultrasound. It actually is a way that you can non-ablatively or without cutting tighten the fascia. The fascia is the deeper layer under the skin, under the fat, but above the muscle. It's very much the plane that we do facelifts on that can pull the muscle together or pull it back. In Ultherapy, we actually make no incisions, but the ultrasound makes tiny little burn marks in the fascia. The day of the treatment, there's a little bit of, I'd say mild to moderate pain and a little sensitivity. After the treatment, the patients really don't see a lot of instant results. But over the next 6 months, much like a scar would tighten, those columns of heat in the fascia tighten and the patient's face is lifted. It's actually really amazing to have a no downtime procedure now for lifting the face. So we combine that with other great lifters like we love Voluma here. It's a product that's placed deep down in the cheeks, temples, mid-face to restore volume that's lost for patients whose faces feel like they're sagging or dropping. Again, these are things that are FDA approved for their indication, and we use them in those ways.